Hi guys, Activator Doc here. So one of the things that I like to do in the office is work on TMJ disorders. TMJ disorders usually mean a lot of jaw pain. Now people can get jaw pain from having your braces on, getting corrective, going to the dentist with your mouth open a lot, car accidents. They can also be a cause of migraines and such. Jenny here has had some issues with migraines before. She had about a month-long migraine. We did a whole bunch of things in that neck, mid-back, even into the scalp, and we've finally decided to give a go with her jaw because she's had issues in the past with that pain. Within 48 hours after this treatment, her migraine finally disappeared and she was able to get back to a normal life. So what we're going to do is I'm going to show you how we can go in and manipulate the structures of that jaw in a nice lack of invasive way. So what we're going to do is I'm going to have Jenny open your mouth for me. So the first thing is we are going to work, and then go ahead and close it. We're going to work into the three muscles, the masseter, the temporal tendon, and the lateral pterygoid. And so when we do that, what we're trying to do is find trigger points. And so when we find a nice point, we're going to apply an ischemic compression and kind of wait until we feel a nice relief. Ischemic compression means that we are trying to get rid of the blood flow. And so with getting rid of blood flow, we can actually release that trigger point. And we're going to go along that whole masseter muscle. Good. Now, when we come up to the temporal tendon, now the temporal muscle is here. A lot of us know that because our temporals hurt and we can get headaches. Well, as the muscle contracts, it actually can pull on the tendon that goes straight through the jaw. And so to come up, there it is. Now what you might notice is Jen may wince or grimace. This is not uncommon. It can be a very painful area because it's rarely touched. And if you notice, we tend to talk and eat throughout the day. You can also hold a lot of emotion in these, so it's not surprising if you cry or feel super happy, giddy, or just generally different at the end of the appointment. So from there, we're going to come up to that lateral pterygoid. That lateral pterygoid actually, if you look, we're going to rotate your head just a little bit, good. If you look, it's very close to that jawline on the inside. Good. And go ahead and swallow. We're going to give her a little break, and the last one that we're going to look at is the medial pterygoid. Now this one's the most difficult and can usually cause some gagging, and I apologize ahead of time for that. So I'm going to have you open, and we're going to come back to center. And now that medial pterygoid is going to be just hitting off the back of these molars. Good. This one tends to not get any TLC, and so we're going to give it some. Doing the same thing with trigger point therapy and ischemic compression. We're just going to massage that muscle out. Good, and relax. And so that's what we do with the jaw. There's other things we're going to do. We're going to show you how to rock tape in just a moment. And this is something you can do to alleviate pain at night. Please check out our other videos on YouTube, Activator Doc, or on our website, thebenchiropractor.com. And then we'll see you later.